First stage of labor by Jones HMMBA DMS. This is a period from the time the cervix starts to dilate up to the time it dilates to its fullest 10 centimeters. Causes of labor. 1. Hormonal causes. The uterine contractions help initiate labor and expulsion of the fetus. So oxytocin is released from the posterior pituitary gland to excite uterine muscles initiating labor. 2. Mechanical causes. This involves excitement of the uterine muscles by the overstretching of the uterus due to pressure of the fetus on the uterus causing uterine contractions. 3. Chemical causes. This involves the release of estrogen in pregnancy that allows the electrons or impulses to pass through the uterine muscles causing contractions. Factors that influence the progress of labor. 1. Passage. In cases where the vagina or birth canal is smaller, that the fetal presenting part then labor prolongs. 2. Passenger. In cases where the fetal presenting part is bigger than the birth canal like cephalopelvic disproportion. This will prolong the onset of labor. 3. Powers. This is when the woman is unable to initiate her abdominal and uterine powers to initiate labor. 4. Personality. Stress causes coordination of the muscles. When woman comes to labor, stress will cause uterine muscles to incoordinate, causing failure or delay of the fetus to be expelled. Physiology of first stage of labor. 1. Fundal dominance. This involves the passage of uterine contractions within the uterus. Uterine contractions start from either sides of the uterus and spreads downwards, pushing the fetus into the lower uterine segment. 2. Polarity. This involves the harmony or coordination that occurs between the two poles of the uterus, upper and lower uterine segment. So as the contraction starts, the upper uterine segment strongly contracts and the lower segment relaxes so that the fetus is pushed into the lower uterine segment. 3. Contractions and retraction. During the first stage of labor, the uterine contractions start from the upper uterine segment and spread to the lower uterine segment. This motion helps the fetus to be delivered. These contractions last for 50 to 60 seconds, but occur every after 1 to 2 minutes. 4. Formation of upper and lower uterine segment. This is a normal thing and process. At the beginning of 16 weeks of gestation, the upper and lower uterine segment starts to form. The upper uterine segment is formed by the fundus, while the lower is formed by the cervix and the isthmus. 5. Formation of the bags of water. The bags of water form in the uterine cavity because they maintain the pressure in the uterus. They are made up of the forewaters and the hindwaters. The forewaters come first and the hindwaters last. 6. Fetal axis pressure. During the uterine contractions, the contraction exert pressure on the fetus become hypoxic, and this initiates more contraction delivering the fetus. 7. General axis pressure. The contractions start from the upper segment exerting pressure on the hindwaters. The hindwater also exert pressure on the fetus, and finally the fetus pushes the forewaters, and the cervix will dilate delivering the fetus. 8. Cervical dilatation. The cervix dilates to its fullest of 10 cms. During labor it starts to dilate so that it evens way for delivery of the fetus. It occurs or takes 1 hour 2 cms in multigravidas and 1.5 to 2 hours per 2 cms in prime gravidas. 9. Uterine contractions. The uterine contractions become more and more stronger and severe so that the fetus is delivered. 10. Rupture of membranes. During labor, contractions become stronger and longer. These contractions exert pressure on the membranes of conception, causing them to rupture, giving access to expulsion or delivery of the fetus. 11. Retraction ring. This forms as the uterus grows toward accommodating the growing fetus. Sometimes it can even be mistaken for a full bladder cause it is seen on the lower abdomen. Note: when you're told to write physiology at DOESNT, mean write all these, look at the attached marks, and then choose what you think will earn you marks. Teffian, Spain. Nursing care aims to monitor the progress of labor. To monitor maternal well-being. To monitor fetal well-being. Environment. The woman is admitted in the delivery room of the labor ward, according to the STEM. Keep room clean to prevent infections. Good let for easy observations. Have a partograph to monitor fetal and maternal well-being and to monitor the progress of labor. The room to have drips stand for if fluids and drugs. All equipments to be used in the second and third stage, e.g. cord clamps, should be available. Position. Woman is advised to be in the right or left lateral position to prevent hypotensive syndrome. Woman is advised to turn for comfort. Use an airing to relieve pressure before labor starts. 2 to 4 relay turnings. Observation. I want to start by saying it's on the observations that we open up the partograph. Observe for the severity of pain. Observe for cervical by doing vaginal exams. Psychological care. Explain to the woman what she will pass through. Explain the pain. Explain to say labor is a normal thing and every woman goes through. Allow her to ask questions even before labor progresses. Encourage her to say the mother or significant other would be close during delivery hospital setting. Explain that it may take hours to complete the all process of labor, especially to prime gravidas. Observe for the woman's response to labor. Observe for the maternal and fetal well-being and progressing of labor using the partograph. So on this one you say, the maternal and fetal well-being including the progress of labor will be monitored using the partograph. Maternal well-being. Observe and record the drugs given for continuity of care. Record any fluids given should be recorded. Observe for vital signs. Fetal well-being. Observe for the fetal heart rate 4-hourly using a Pinard's fetal scope. Observe for the state of liquor even for meconium stains. Observing for molding. Monitoring progress of labor. Observe for uterine contractions. Observe for cervical dilatation. Observe for descent of the fetal head. Nutrition. Woman requires energy during labor. Give energy-giving drinks for energy. If unable to swallow IV Dex, give easily digestible foods. Infection prevention. Use sterile equipments. Use antiseptic solutions on vulva swabbing. Use sterile gloves on doing a vaginal exam. Ensure a clean room. Pain management. Observe for severity of pain. Give analgesics. Tell mother to be taking a deep breath during each contraction. And continue observing for pain. Rest. Woman need rest to reserve energy required for pushing. Bladder care elimination. Advise woman to be emptying bladder regularly to prevent bladder injury. If unable, then catheterize the woman to drain even as a full bladder may prolong labor. Clean catheter if dirty or change. Exercises. Advise woman to be walking round the delivery room provided the cervix hasn't dilated more than 6 cm. Exercises help in the descent of the fetal head. This also promotes blood circulation.